welcome. My name is Savita Gupta. This is the Pandemics in Comparison team. We've spent the past 6 weeks conducting intense qualitative research, and we're really excited to share our findings with you. We had the privilege of working with PI Whitney Welsh and graduate team member Sophia Goodfriend. We hope you enjoy our presentation. Welcome to our project, Pandemics in Comparison. Today we'll be sharing with you our comparative analysis of Durham's response to pandemics in 1918 and 2020.
Our team explored Durham's response to the 1918 influenza pandemic and the COVID-19 pandemic through a comparative lens. Through archival research, we were able to gain insight on our research questions. How did Durham respond to the second wave of the influenza pandemic in 1918, and how is Durham responding to the COVID-19 pandemic today?
We conducted a qualitative analysis of several archival resources. We dove into Durham Morning Herald newspaper articles dating from late September to late November of 1918 to learn about Durham's actions for influenza relief and cautionary measures. It's important to note that the Durham Morning Herald targeted a degree of erasure and omission of information regarding marginalized groups, such as Black communities in Durham. Understanding this intended audience helped us maintain a critical mindset while examining the newspaper, which paints a limited scope of history. To evaluate Durham's pandemic response in 2020, we looked at articles from the Durham Herald-Sun, emails from Duke University, and tweets from members of the Durham community. To organize our findings, we used 5 categories: disease trajectory, health systems response, government response, public response, and unintended consequences. To understand the 1918 pandemic, we built a matrix in Excel. To evaluate Durham's response to the 2020 pandemic, we used qualitative research analysis software NVivo. And here are our findings.
Though the coronavirus and Spanish flu have similar case numbers and deaths in Durham, when considering population size, the Spanish flu is much more widespread and deadly. The Spanish flu outbreak lasted 6 weeks, resulting in 5,000 cases and 96 deaths, and a population of around 33,000. The coronavirus outbreak, which is still on the rise after 3 months of community spread, thus far has caused over 3,000 cases and 62 deaths in a population of over 300,000, making it about 10 times less prevalent, though it's hard to predict how much this may change in the coming months.
The response of health systems has shifted significantly since the 1918 pandemic, but some elements actually remain the same 100 years later. In both 1918 and 2020, hospitals and healthcare workers served as the first line of defense. For both pandemics, hospitals constructed temporary structures to treat a surge of patients. In 1918, temporary structures were set up in East and West Durham and Hayti to deal with the high number of infections. To prepare for the COVID-19 pandemic, Duke, UNC, and Wake Med set up similar temporary structures outside their hospitals. Another similarity between the pandemics is that in both cases, hospital visits were recommended for critical cases only. In 1918, nurses were often sent out to treat people in their homes, and volunteers replaced them in hospitals. In 2020, some patients also consult with primary care doctors in their homes via telehealth consultations. One difference in health systems response was staff shortages. In 1918, the published response of health systems was dominated by advertisements for nurses and doctors. In 2020, though, while some articles described how physicians were pulled from their residency programs to attend to the crisis, advertisements calling for nurses were rare. The most significant difference between 1918 and 2020 is the advance in technology. In 1918, there was no way to test for the presence of the disease. There were also no technologies or drugs used to treat the Spanish flu. In 2020, ventilators and access to oxygen masks has changed the way doctors treat the virus. However, despite all of these technological advances, the primary response to both 1918 and 2020 pandemics was an implementation of preventative measures.
In both outbreaks, the government took early action to limit spread by limiting or closing schools, theaters, places of worship, and other places of public assembly. One of the clear distinctions between 1918 and today is the increased influence of the state and national government. In 1918, the response was coordinated almost entirely by the Durham local government. Though the state issued recommendations, the state was largely unable to impose itself on local governments. In 2020, the state and national governments played a much larger role, with Governor Cooper issuing most of the restrictive orders and with the federal government supplying most of the monetary aid. Though Durham undoubtedly played a significant role and could adapt some of the governor's orders, in some cases the state order didn't even allow local governments to have looser or tighter restrictions than the states. One part of the government response that did not exist in 1918 is the aid used to prevent the economic fallout of the lockdown. In 1918, possibly because of the economic mobilization for the war effort, there was no talk of an economic recession as a result of the restrictions, and the only aid given was meant for the public health response. In the present day, government policies such as the federal stimulus bill are focused just as much on protecting the economy as they are on protecting public health.
In 1918, World War I heavily influenced cultural attitudes toward influenza relief efforts. When Durham was incredibly short-staffed, health officials called on women to serve their community to prove their loyalty to their country. Recruitment tactics framed volunteering as an act of patriotism, implying that those who did not volunteer were slackers, a term used to criticize those who did not contribute to the war effort. Revealing a collective mentality that the epidemic was a part of World War I, the flu was covered in local news as a war mobilization effort. In fact, articles equated coughs and sneezes with explosions as dangerous as poison gas shells, and this warlike portrayal of the epidemic rendered relief effort as another war front, fought primarily by women, volunteers, nurses, and physicians. With questions of patriotism in the air, those who broke health regulations were considered unpatriotic. Ironically, the flu was deadlier than the military combat, but people greatly feared the war and took chances with the flu. Conversely, in 2020, those who opposed safety precautions such as mandatory use of masks claim that such regulations are an unpatriotic violation of constitutional rights and liberties. With inherent privileges and economic interests dividing the American population, a public health crisis quickly transformed into a politicized issue.
Politics played an important role in both 1918 and 2020 in the nation's response to the pandemic. Our group found the most interesting point of comparison mail-in voting. Both pandemics took place during an election year. In 1918, illness was not a sufficient excuse to submit a mail-in ballot, but today the CDC recommends flexible voting options to reduce infection, though not all politicians support the idea.
In both 1918 and 2020, churches were central to the debate about restrictions. Churches were forced to close entirely in 1918 and were limited to 10 people in 2020. While some pastors in both epidemics opposed these limits as unfairly targeting places of worship, the general sentiment in Durham during both epidemics was to support the restriction. Soon after the bans in 1918 were put into place, the Durham Ministerial Association passed a resolution in support of the measures, treating it as an opportunity to bring religion into the home, and pastors generally did not hold services. Even when 10-person services were allowed toward the end of the outbreak, most churches decided not to hold services until the full congregation could meet. In 2020, however, there was significant pushback against the order, with some North Carolina sheriffs stating they would not enforce the 10-person limit. On May 14th, a rally was held in front of the legislative building to protest the lockdown orders, particularly the church ban. Soon after, a lawsuit that made it to the state Supreme Court resulted in the limit on places of worship being struck down. Despite the ban being struck down, the North Carolina Council of Churches asked that its members do not hold services.
At the start of the 1918 epidemic, a particular newspaper clipping speaks volumes to the racial disparities of the time period. One article detailed a white pastor who voiced opposition to church closings in an open letter to the Board of Health. He argued that churches were sanitary and his concerns were depicted as valid. Directly adjacent to his letter is an article that captured the dilemma of a black church leader whose income depended on church work. Yet this second article expressed that any black person who violated the regulations would be immediately prosecuted and arrested. Furthermore, black store owners may have been especially targeted during sanitary inspections. The inspector specifically called Hayti grocery conditions deplorable and threatened to revoke licenses if improvements were not made. While the death rate was higher for white citizens, a trend mirrored in many cities, many attribute this difference to herd immunity caused by a previous wave of flu that exposed black communities at higher proportions. A century later, and the accumulations of structural racism in healthcare, economic opportunities, and all realms of life have caused Black people in Durham to be disproportionately challenged by COVID-19. Black people are overrepresented in both cases and deaths, and Black families are more likely to be impacted financially. In addition, Durham's racial demographics have changed dramatically since 1918. The city's Latinx community has been heavily impacted by the pandemic as well, working high-risk service positions yet barred from receiving any federal aid and lacking essential healthcare access. Many who are undocumented are struggling to meet ends. In both pandemic responses, marginalized racial communities lack equitable healthcare access and resources to live through the public health crisis. We will now conclude by examining some of the lasting impacts of the 1918 influenza in Durham and contemplating lingering questions for our near future. During the influenza outbreak, Durham banned the use of unsanitary cups and soda fountains. After the epidemic, this ban remained. In addition, stricter health guidelines were enforced in public places such as movie theaters and grocery stores, and the flu, along with other diseases, became reportable for the first time, allowing governments to better track the spread of disease. It is currently difficult to determine how the present pandemic will have lingering effects on our society, but we are already seeing how our fundamental systems and protocols are being challenged. As we are living through this pandemic today, our research team has pressing questions about our near future. For example, with states reopening against the advice of health officials, how will potential spikes in cases be addressed? And in the wake of the murders of Breonna Taylor, George Floyd, and so many other Black individuals, will the protests for racial justice have any impact on COVID-19 cases, given that many protesters wore facial coverings? And how might these protests be framed in the media in comparison to Memorial Day celebrations that took place weeks before?
So I think that we can begin taking questions. Our first question says, after this comparative research, do you have any recommendations for us today? I can share my thoughts on it first if you guys also want to chime in. I think that being mindful of where we are in our pandemic, the wave that we studied in 1918 was the second wave of the Spanish flu, while we are still in our first stage. It was incredibly deadly to that community, the Durham community, in 1918. And in that time, the restrictions placed by the local government were well followed, to the best of our knowledge based on what we read. So as we go forward with the pandemic and enter our second wave, conflating with regular cold and flu season, all protests for, government shutdowns and social distancing guidelines, criticism of that should be pretty carefully considered, because even when everything goes well and citizens are compliant with restrictions, it can have a pretty devastating effect.
Just adding to that, we also saw articles in how in 1918, despite a push by merchants and business owners for the reopening or the extension of store hours, which were reduced during the pandemic, the Board of Health was very insistent on keeping stores closed, and I think that was very helpful in reducing further devastating impacts. And I think today we might have to consider resisting premature openings.
Yeah, I could answer the next question, which is, you mentioned the 1918-1919 temporary healthcare structures were built in Haiti, and you surmised that the higher death rate in whites in the second wave could suggest higher herd immunity in Blacks. Do you have data on morbidity and mortality for both and other races, or do you have to rely on circumstantial evidence? So there was an article towards the end of the pandemic that said that if we interpret it correctly, that like the mortality for whites and Blacks, the mortality for whites overall was higher for Blacks for the year, like not just in the pandemic. And so that means that this difference in mortality had to have been relatively significant. But we don't have specific data on the disease, like more morbidity differences between whites and Blacks.
But we do know, and the hypothesis about Blacks having higher immunity is not from our Durham research. It was actually from someone else's research on other cities, because this appeared throughout the country in multiple cities that Black people had a significantly lower mortality than whites.
Do you guys have a bias on the last question we answer, a preference?
There's a question that's asking, did you see any evidence of how educational institutions handled the 1918 pandemic? And to answer this question, when the 1918 pandemic was impacting Durham, schools were closed and shut down, and this left a lot of teachers without jobs, and with the closing of schools caused a call for teachers to aid in the pandemic response. So we saw a great mobilization of teachers aiding in relief efforts. And I think we saw some articles of schools being used as temporary facilities for aid relief. And if anyone else wants to speak on that.
One interesting coincidence that we did see between Trinity College and Duke University's response in 1918 and 2020 was that both campuses recorded some of the first cases of the pandemic. So Trinity College at one point had 35 cases of the Spanish influenza when the amount in the town was significantly lower. And similarly, Duke recorded at one point, there was 15 cases in Durham, and Duke students were 7 of those cases. They had returned from a trip, they were MBA students. So that was an interesting trend or coincidence across 100 years.